Message today is to talk about fair audit reform. This is a bill that's sponsored in the Assembly by Charles Levine and in the Senate by Senator Marty Golden. So I want to talk to you about fair audit reform. First, I'd like to start by telling you that well over 90% of the prescriptions that are filled in community pharmacies and throughout all pharmacies are covered by an insurance plan, which include a pharmacy benefit. And for this reason, it's appropriate for agents of insurers, health plans, or other payers to conduct audits for claims submitted to them for payment. The problem arises when some of the audit practices are unreasonable, excessive, and sometimes invasive. And I'd like to give you a few examples of that. Total recoupment can be excessively punitive. And what I mean by that is sometimes auditors will claim or take back the total amount of claim or a prescription based on the fact of a clerical error or a typographical error when there's no harm to the patient or the payer. Secondly, many times the pool of prescriptions that they choose are your most expensive claims. This legislation allows for a random sample to be conducted and no more than 100 prescriptions in a 12-month period. Other times you get an audit and you don't get the results for 6 months afterwards. That is too long, because if they require supporting documentation after that, patients could have moved, physicians are no longer reachable. So this legislation calls for a 45-day turnaround. And then there are times where you just get insufficient notice or workable timetables to comply with an audit. This bill standardizes procedures and protocols and timeframes in an audit without affecting the ability to detect any fraudulent activity. Of course, we support uncovering fraud in wherever it may occur. But we truly believe that a pharmacist's time is best spent counseling their patients about drug interactions, about allergies, and consulting with their prescribers so that they may achieve the best possible outcomes. Fair audit reform has been passed already in over 30 states, and we look forward to getting it passed here in New York in 2018.